Hello, I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute. I'm here with Brianna Durand to talk about the new course that she created for the Institute. Brianna, would you tell us a little bit about your background?
Sure. So I'm a physical therapist. I went to PT school in Houston. And then while I was in PT school, I knew I would want to relocate to Seattle. So I started doing internships up here. And I was really lucky that I got to both have a pelvic health internship while I was still in grad school and start taking some Con Ed coursework on public health before I graduated. So now I'm here and I operate my own private practice that's orthopedic and public health focused.
And what is the new course that you wrote?
So it is about gender, providing affirming care to gender and sexual minorities, and it's meant to be welcome for anyone, even folks who feel like they're not quite sure how to get the pronouns right or what terminology to use. So it is meant to have the most basic foundational knowledge for folks so that they feel more comfortable, as well as provide a safe space for people to ask questions that maybe they felt a little bit afraid to ask in other environments. And then moving on to more of the more detailed physiological considerations from a pelvic health standpoint, but also from a general health standpoint for folks who are undergoing medical transition.
hmm And how did you develop your interest and knowledge in this topic? Because it certainly isn't something that most of us in our graduate programs, regardless of how we come to this work, we are, don't have much exposure.
Absolutely, and that's part of the driving factor. So I am part of the LGBTQ community, and when I was in grad school and we learned about things like the influence of estrogen on bone density, I remember asking my professors, "Well, what about folks who are trans or people who take exogenous hormones? Like, what research is there out there?" And then even more so when you get to pelvic health and you learn about things like atrophic vaginitis and the influence of hormone-mediated pelvic pain, etc. So I was lucky enough in grad school to go to like CSM and National Student Conclave, and I met other grad students. And I was just aghast at the differences in our exposure to Con Ed on this population. So some people have a guest lecture, some people have a chapter in a book, but many folks, including myself, there's no mention of this community in formal education. So I, with the help of other grad students and some very wonderful mentoring faculty, we started a special interest group specifically about providing more resources, both for LGBTQ students and practitioners, but also to help meet this knowledge gap.
And is that a special interest group that other folks can join at this point? Or how else do you recommend that people can continue to learn and meet other folks?
Yeah, definitely. So it's growing now. There is more both formal research for folks to read, and there's more Con Ed becoming available, but it's still, I think, in comparison to a lot of other niche practices, it's still kind of few and far between. So, yes, that special interest group is under the Health Policy and Administration section of the APTA. It's called
Mhm.
PT Proud, and it is no longer specifically student led, I believe. I was the chair, but I have since pass that on. But we have some wonderful folks contributing to that group, like Carla Bell. Yeah, so I think that that's a great resource for folks. But then there's also for self learning things like the W Path, UCSF, UC San Francisco has a lot of resources
Mm,
online as well.
wonderful. What content categories are within your course, and which of them do you find, and this could be all of them, but which do you find that practitioners are perhaps almost surprised that they didn't know some of these pieces?
So I think one of the biggest ones, which is a huge passion of mine, is folks who are intersex. Is one we might learn about Klinefelter syndrome in like basic biology in undergrad, but most folks aren't aware that there's so many different types of intersex variations and how someone can appear phenotypically what we expect a female to look like, but their internal organs are very different, and how for some folks, depending on the type of intersex variation they have, they could benefit from things like dilation, for example, or other pelvic floor specialization. So that's one component. Another component is people are often surprised that to find that trans men can indeed become pregnant. I have treated a few of them. I've had the honor to work with several transmasculine folks during and after their pregnancies. So that's a surprising factor for some folks. And then even just learning, because I do provide in the course some background of the legal landscape and the history of this community and the kind of collective trauma over generations and the historical pathologizing of different folks in the LGBTQ plus community.
Mhm.
And I think folks are still sometimes surprised to see that even though there has been progress made, that still definitely exists today.
Mhm. And what feedback did you get from the first offering of this course? What kind of aha moments did you get as the instructor who put this information together, and that really again inspired you to continue to work and learn and perhaps even do a little more of your own research based on some of the things that people asked you?
I learned so much from the participants in the first course. It was probably one of them because I've attended several permanent walls and other pelvic floor con-ed courses, and this was probably one of the most interactive ones that I've ever had the pleasure of participating in. But we had several practitioners in different countries participate in this course, and it was really interesting to hear their perspectives. I think one was from Sweden, one from the UK, one from Australia. And then also I was reminded, we all have our biases, that I was speaking definitely from a very Western United States focused lens. And so it reminded me to go look at other cultures, such as the third gender that has existed in the various cultures in India for a really long time, or the inclusion of the two spirit identity from Native American and indigenous cultures, etc. So that was one component. And then I actually, because no one person can know all of it, right? And there's so many subgroups in this community, there were a lot of participants who gave their feedback on their specialty. So there were some folks talking about their experience working with clients who had had breast implants as part of their top surgery. And I learned about many different types of implants I didn't even know existed and the ever changing technology. And even someone told me that there is an app that now people can use to find gender neutral bathrooms, which is a great resource to have for patients. Those are just a few, but I learned so many things I can't possibly
Mhm.
live now.
And what would you say to folks who might think, well, I'm not sure I'm going to be working with many folks in the trans health population. And so, do I really need this course?
Mm. Oh man, that's tough. I would say you probably already have, and you may not have known it. It's not that the population is growing, it's just that as society changes, people are feeling more safe to authentically live as themselves, which I think is a beautiful thing. But all it takes really is to look at the Gallup polls over the years. So when I was in grad school, less than 4% of the population was estimated to be LGBTQ plus, and as of 2020 it's now 5.6. And when you go to younger generations, that self-identification jumps to the double digits,
Mm,
which is, like I put in the course, more than the population of the entire state of Colorado. And I think that there's a lot of folks who have already interacted with this community, and not necessarily just trans folks, but there's so many different sub-identities within the LGBTQ plus community. But they definitely will going forward, 100%, no doubt about it, because we're everywhere. It's not just outpatient or ortho or pelvic floor. There's pediatrics. I've worked with folks in some skilled nursing facilities who are
mhm,
LGBTQ. We're everywhere.
mhm. That's beautiful. And could you speak briefly to how important it is not only to recognize our role in providing excellent care within our rehab communities, but also to avoid the potential for harm, which is very real?
Absolutely. And I would say, if nothing else, because I recognize that this can be overwhelming. I sometimes feel overwhelmed, and I have been actively participating in the advocacy for this community and trying to self educate more about this community, because I can only represent like the component I identify with. And even then, I'm one intersection. There's so many other identities that I had to learn about, and continue to have to learn about. So I see how overwhelming it can be. But if nothing else, trying to reduce harm is so invaluable. At any given point in my practice, over 50% of my patient population are LGBT. And I would say almost all of them specifically have sought me out because they know that they're not going to be misgendered. I'm not going to use their dead name, which is the name they were assigned at birth that they no longer use. I am being mindful with my language about what they use with their body parts, what they call their body parts, how they want to refer to their body parts, etc. And simple things like that, in the grand scheme of things, doesn't change my clinical practice that much from the average person might do. It's just the reframing and the more intentional language and how much that means to the patients that you treat. Mhm.
Mhm. Well, thank you so much for sharing about your course, and we look forward to the next scheduled dates of that course and any other classwork that you develop in the future.
Thank you. I'm very excited to offer it again.
Thank you.